All right, hello everybody. Today I want to talk to you all about cardiovascular and systemic infections. When we say cardiovascular, this means anything to do with your heart, valves, membranes surrounding the heart, blood vessels and veins. Systemic is also referring essentially to the fact that if something is infecting the cardiovascular system, or if you have, for example, germs or pathogens circulating in your blood, blood vessels and veins, this is going to be widespread, system-wide. So a systemic infection is system-wide, so it's a body-wide type infection. For 4.7, what I want you to do is watch this PowerPoint lecture video as you're doing now. For 4.14.20, I want you to watch this Ebola video. I'm going to show you in just a second and answer the questions. Post them to Canvas for clicker points. These are going to be due on 4.14.20 by 5 p.m. to get full credit. Ebola, the reason I've got this video, we're going to highlight the disease Ebola because it is a systemic type infection. Let me go and show you now on Canvas where you will find this. So if you go to our Canvas site, you will see this lecture that I'm making right now. You don't see it there yet, but it'll be, cardiovascular and systemic infections PowerPoint video. That will be there. So this is where you're going to watch that. You've already done that. And then you're going to see the Ebola questions here. So if you click on this, it's going to take you to a YouTube video where you can watch this NOVA Ebola, the Plague Fighters. It's a really awesome documentary. And then there's a question set. Of course, you're going to open this document. You're going to save it to your computer. You're going to type your answers in. And then you're going to go back and go to assignments. And you will go to clicker Ebola questions. You'll see they're due April 14th at 5 p.m. for 10 points. You've seen these. You've been submitting video questions here already, so just one more to submit. Let's move that up. It should look like that. No, wait, too far, right there. All right, okay, let's get back on track. Okay, so cardiovascular and systemic infections. What are we talking about? Remember, we're not just talking about like cardiovascular disease, okay? Most of the time that's what people are talking about. Instead, here we're talking about infectious diseases, right? These infectious diseases will affect the heart, and if it's affecting the heart, it's generally going to be, traveling throughout the entire body system through the blood vessels and veins, because that's what the heart does, right? It pumps blood all throughout the body, and so if you've got pathogens there, it's likely going to be carried throughout the entire body. You can also have, because you also have a lymphatic system. The lymphatic system carries lymph, which is body or tissue fluid, tissue fluid all around the body. So this is sort of the lymphatic system carries the fluid around the body. The cardiovascular system carries the blood around the body. Both of these are closely linked, and there are places where the cardiovascular system carrying the blood links to the lymphatic system carrying the lymph, because the lymph does enter into the blood, okay? So they are connected. So oftentimes pathogens will be carried around the body in both of these systems once it reaches one or the other, because they do mix, if that makes sense. All right, so systemic infections, like I said, these affect a number of organs or tissues, and they kind of affect the body as a whole. And cardiovascular disease, remember, we're not talking about like blocked blood vessels due to like plaque buildup, cholesterol, or something like that, okay? These are generally focused on in our society because they're more common. I should say heart attack, not heart attach. We're focused on infectious diseases, okay? You can have infectious diseases of the heart. You might have heard of something called pericarditis. This is infection and inflammation of the pericardium. That's the thin sac-like membrane that surrounds your heart. This is typically caused by a viral infection or after a heart attack or heart surgery, and can also develop from AIDS. You could also have something called endocarditis, which is an infection of the heart's valves or inner lining. This type of infection can damage your heart and should be treated right away so it doesn't become deadly. Most people who develop endocarditis have damaged heart valves already or other heart defects. Either way, though, if this happens, it usually occurs when germs travel through the bloodstream, travel through your heart, and attach to the damaged heart tissue. Bacteria can spread as a result of unhealthy teeth and gums. This is a common means of endocarditis. You've probably heard that oral health is linked to heart health, and that is because if you have a lot of bacteria on the teeth and gums, they can easily enter into blood vessels and veins there in the mouth, and it can travel through the vessels and veins and attach to and affect heart valves, and heart tissue. So this is one of the reasons why they really stress that you should take care of your mouth. And if you notice any type of blood or bleeding of your gums, it's a sign that you really need to start ramping up, your oral health. Okay, so bacteria can spread, like I said, and you can get endocarditis as a result of unhealthy teeth or gums. It could also come from a skin sore, a sexually transmitted infection, or a catheter or needle. Dirty needles are often, or catheters can be blamed for endocarditis or can lead to it. I've also been told that certain dental procedures, for example, can really, even if you have healthy, oral health, certain dental procedures can be really risky, and so sometimes, I don't know, it might have happened to you where you've had a procedure coming up and the dentist has asked you to take antibiotics for a couple of days prior to your procedure. This is because the procedure itself might open up might open up blood vessels and veins in the mouth and might allow pathogens to enter into the blood vessels and veins and then make their way to your heart. There's also a third type of heart infection, myocarditis. This is a rare disease. This is when you get an infection of the heart muscle, an actual infection of the muscle itself. Muscle infections are pretty rare, and this is kind of a mystery, this myocarditis. It tends to affect otherwise healthy people, and so it is very rare though, so there's not a high number of this, but research is still being done on the causes. Now, if you do get an infection in the heart, symptoms will likely include shortness of breath, fatigue, lightheadedness, fainting, heart palpitations, chest pain or pressure, fever, abdominal or leg swelling, blood in the urine, aching joints and muscles, and you will also develop, or you might also develop, I should say, a rash called petechiae. This rash has tiny red or purple spots on the skin, whites of the eyes, or insides of the mouth. All right, treatments. I'm going to show you pictures of this coming up. Treatment of this would be antibiotics. You might also get something called lymphangitis, which I'm going to show you that too. It's these red streaks where you've got swelling and inflammation of the lymphatic system. All right, so the cardiovascular system, I mentioned that it's composed of the heart, blood, and blood vessels. I don't want you to become an expert on the cardiovascular system here, but I do want you to know in general that you've got the heart, right? This is a giant muscle. It's going to pump blood into blood vessels. All right. You're going to have arteries that carry blood away from the heart, and you have things called veins that carry blood to the heart. Arteries generally carry oxygen-rich blood away from the heart and towards the body tissues and organs. And then veins will return the blood back to the heart from the tissues and organs once the organs have depleted the blood content of its oxygen. And so this is generally going to be more oxygen deplete blood, and it's going to have a higher amount of carbon dioxide. If you look at the blood, the composition of the blood is going to be mostly liquid, like it's a red liquid, right? You do have a liquid component. It's mostly water. We call that the serum. But in the serum, you're going to have like most of the dissolved components, things like antibodies. There's going to be nutrients. There's going to be gases and things. Inside that liquid component, in addition to the smaller dissolved components, you'll have formed elements. Red blood cells are the erythrocytes. Leukocytes, these are white blood cells, so that is your immune cells, things like B cells and T cells and these macrophage. And then you'll also have platelets. These are involved in blood clotting. All right, so here's sort of an image. Don't panic about this. Like I said, I'm not going to ask you to memorize this. I will not test you, for example, on the light the left or right atrium or ventricles or any of these arteries or veins. I do want you to know, though, for example, when we were talking about pericarditis, this would be the membrane that surrounds the heart. So if you had pericarditis, this is where that infection would be. If you had myocarditis, it would be in this muscle. This was the really rare one. Endocarditis is an infection of the inner lining or the valves, okay? And what you see, so here's the heart. They've blown it up in this box. Here it is over here. And when you're looking, you see lots of vessels, blood vessels, and you see veins and arteries. The arteries are, like I said before, are usually more oxygen rich, and so they are going to be colored in red because oxygen rich blood has a redder appearance, so they've kind of color coded this for you. And then the veins, because when the oxygen, or excuse me, when the blood gets more deplete of oxygen, it has more of a bluish tint. So they've colored the veins blue for that. All right. So some terms that you really need to know. I've told you that infections of the cardiovascular system tend to be what's called systemic because it is system-wide. We have other special names to sort of give a little bit more detail about that systemic type infection. So we have a term called septicemia. This really is kind of interchangeable, and I guess as far as our purposes go, we could think of it as interchangeable because something that is septic is going to be an infection of the blood. So if you've got a blood infection, you are said to be septic. And we know that if you have a blood infection, that blood is going to travel around the body, right? And it's also going to be systemic. So that is why I generally kind of look at those two terms as being very similar. Now, when we say someone is septic, that really does not tell us anything about the type of infection, right? Because it's any microbial infection of the blood. So you can use some terms to give a little bit more detail about that case of septicemia. We could say it's viremia. Okay, viremia means that it is viral septicemia, and this means that you have a viral infection of the blood, and that virus is gone. It is system-wide. It's systemic. It's this viral septicemia. It means you have a viral systemic infection. You could also say it's bacteremia. That specifically tells you that it's bacteria causing the septicemia. You could also have something called toxemia, right? In some cases, we know that bacteria that cause infections, we've talked about this over and over, they can make toxins. And if you have bacteria circulating in the bloodstream, it's likely that, yeah, they're releasing toxins. And oftentimes, if you have bacteremia, you will also have toxemia. Toxemia is a state where you have bacteria in the blood, and they are releasing toxins in the blood, and these toxins are then spreading system-wide. All right, septicemia, a major sign of this. I did read off some of those, signs and symptoms, and I said that you could have something called petechiae. You can also have something called lymphangitis, and I want to show you those. And this can all lead to septic shock. All right, if you have lymphangitis or petechiae, this is a warning sign. Get your rear to the doctor, get treated. You probably don't feel good anyway if you've reached this type of level of infection. You are at risk for septic shock. All right, what is septic shock? Septic shock can occur when you have a case of septicemia. All right, this is due to an activation of the immune system, basically. If you remember back to the immunity section where we covered sort of that inflammatory response, if you remember, when the immune system reacts to an invader, histamine can be released. Histamine release will trigger dilation of blood vessels and veins. All right, this dilation is a widening, an opening of the blood vessels and veins. And remember, the cells that line the vessels and veins, they actually spread apart and open up, and this allows fluid leaking. And this fluid leaks out into the tissues. and immune cells leak out into the tissues, and this allows the immune cells to get out and fight the invaders. Okay, so there is a purpose for it. However, if you have widespread infection and septicemia, this can lead to an overactivation, let's say. So much histamine can be released, so much dilation of blood vessels and veins, so much tissue leakage that what happens is the blood pressure drops, because if you lose too much fluid from the blood system, right, it's going to lower, 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 and lower, and it's going to get such low pressure that it's going to be impossible for the heart to continue pumping blood around the body. And so this can lead to death. All right. So what's lymphangitis and petechiae? Let's look at it. Before we do, I want to show you a clicker question that I tend to ask people. I know that since we can't do clicker questions, what I've done is I've just sort of left in last semester's data so you can see sort of how those people answered. So here's the question. Viremia refers to A, viruses in the blood, B, blood poisoning due to toxins, C, bacteria in the blood, or D, inflammation of the lymphatic vessels. Most people said A, which is the correct answer. Viremia is viruses circulating in the blood system-wide. So it is septicemia due to viruses. All right, here's you a lovely image of lymphangitis, okay? This is a sign of septicemia. This is a red streak going down this person's arm. What's happening there? You've got a lymphatic vessel or vein, right? So you've got lymphatic vessels that go all around your body system. And if these lymphatic vessels are carrying, so I guess lymphangitis is a sign of infection of the lymphatic system, I should really say. This is indication that there is a lymphatic vessel that is inflamed, swollen underneath the skin there. And so we've got inflammation of that lymphatic vessel. Remember, inflammation, one of the big signs is swelling, redness, heat, and pain. All right, and so you've got swelling and redness, probably hot to touch too if you were to touch this. It might be painful as well. All right, so signs and symptoms of septicemia: fever, chills, nausea, vomiting, diarrhea, shortness of breath, malaise, and if it gets bad enough, changes in mental status. You can end up being very, very lethargic, delirious, and it can lead to septic shock, like I just talked about. You can also have, so another sign of this is petechiae. These are more of a sign, less of a sign of lymphangitis, more of a sign of infection of the bloodstream, because these are small hemorrhages where little blood vessels like capillaries underneath the skin have ruptured and just burst due to the infection. Let's look at it. This is an example of red petechiae. These can be reddish all the way to a purplish color. So red or purple, either way. If you have small, tiny hemorrhages on the skin, this is a sign of bacteremia. Or really, it could be viremia. It's just really what I would say. This is a sign of infection of the blood vessels and veins. All right. You can also, if you have a septic infection, end up with bone infections because bacteria can invade the bones from the bloodstream. And remember, toxemia symptoms, those guys, because toxemia is really a toxin released into the bloodstream, it's going to vary. I can't really tell you what the signs and symptoms are of that. It is going to depend on the toxin, all right? So if it's an endotoxin, a sign and symptom of that is going to be shock. All right, so this would greatly contribute to septic shock because remember, endotoxin, gram-negative bacteria, that's their outer membrane. This overstimulates the immune response and leads to dilation of blood vessels and veins and shock, which the bacteria circulating in the blood are already doing that. And now if you've got endotoxin being released, it just adds to that. You can also have exotoxins. Remember, some of these are neurotoxins binding to nerves. Some of these are enterotoxins, maybe causing, gastrointestinal symptoms. Some of these are cytotoxins. Maybe they kill cells directly. Do a variety of things depending on what type of toxin it is. All right. So which of the following are minute hemorrhagic skin lesions? Petechiae, interferons, interleukins, or lymphangitis? Most people said petechiae. Great. These are the hemorrhages that occur under the skin and cause the little red or purplish rash. All right. Now, when we say we've got septicemia, bacteremia, viremia, and toxemia, what in the heck? This is a lot of things that we're talking. These are some major categories, okay? There's really nothing specific here. What types of organisms can cause these things? There's going to be a variety, as you can imagine. Viremia, there's going to be a number of viruses. We're going to look at Ebola. We're going to look at mono, so Epstein-Barr virus. Septicemia, bacteremia, we're going to look at things like bubonic plague. We're going to look at some other examples. I also have an example of septicemia that is not bacteremia or viremia, so I brought in like toxoplasmosis. Oh, and I'm forgetting Lyme's disease is bacteremia. So it can also be caused by a protist. But we don't have like protosteremia. There's no name for that. It would just be septicemia in that case. And also, I want you to keep in the back of your mind that oftentimes these can be the result. So some of the like really fancy examples I'm showing you aren't the most common ways, right? The most common types of septicemia and bacteremia, also viremia, really are opportunistic infections. So maybe part of your normal microbes, your normal flora. And because of some sort of status of your system, you know, this infection's able to like invade further. It can also be nosocomial. So a lot of these are hospital-borne infections, right? There's lots of organisms in the hospital that are very resistant to antibiotics. Lots of patients in the hospital have reduced immune status. They're weakened from other surgeries, procedures, infections, etc. And so a lot of this happens as opportunistic type infections that result in the hospital. And so this kind of backs this up. Immunocompetent individuals, that means your immune system is good status. They typically don't have septicemia. Bacterial infections, viral infections are going to be typically self-limiting in those people. Gram-negative bacteria often produce more severe septicemia. Examples include E. coli and species of Salmonella that make up a large portion of the normal bacteria in your gut. If your immune system gets weakened for any reason, those bacteria can, the E. coli or Salmonella, they can actually leave the intestines. They can invade deeper and cross over into the bloodstream. In addition, because remember, gram-negatives produce the endotoxin. Like I said, it really does sort of ramp up the risk of septic shock. All right, treatment is going to be really important. Like I said, because this is very, very serious, all right, especially in people with suppressed immune systems, like people that are alcoholics, drug use, malnutrition, stress, HIV infection. They can't effectively fight bacterial infections, and septicemia is more likely to occur and to be, more severe for them. Immediate treatment is going to be very important with those that have a compromised immune system, so that they don't, so that it doesn't end up being fatal. All right, so an awesome example that you guys have probably heard of is African viral hemorrhagic fever. This is an example of a cardiovascular and systemic infection. This is also one that goes very much against most of the guidelines that I've just given you. So I just said that most of the time you have to be immunocompromised. You have to be weakened in some way. And that's how septic type infections arise. However, in this case, it's not true. What I'm talking about with African viral hemorrhagic fever, this is Ebola or Marburg. So that's what I mean. So African viral hemorrhagic fever is a very fancy way to say Ebola or Marburg. Okay, so what is Ebola? Ebola and Marburg are both hemorrhagic viruses. They belong to Filoviridae family. This is a family of viruses, but specifically the Ebola and Marburg viruses, they were named for the sites where they were first discovered. So Ebola was named after this Ebola River, which is a river in Zaire where the first Ebola outbreak occurred back in the 70s. And then Marburg virus, this virus was named after an infection that happened in Germany, in Marburg, Germany. Okay, so both types, Marburg is not considered to be as severe as Ebola virus. However, you all are going to watch a video and there's going to be multiple types of Ebola viruses, and it kind of highlights the lineage. It's really cool. It talks about the family tree of the Filoviridae, and it shows you where Ebola comes in and the different types of Ebola viruses, or at least the different names. And it does tell you a little bit about which one is more severe than others, but basically neither of these are good. None of these are good. Both types will begin with a fever, fatigue, dizziness, muscle pain, followed by minor petechiae. These signs and symptoms develop for 2 to 21 days after exposure to Ebola, and then 5 to 10 days after Marburg exposure. Both will quickly progress to severe internal hemorrhaging as well as bleeding from every body orifice, meaning the mouth, eyes, and ears, even the GI tract. Blood is coming from everywhere. Death results from shock. The body pretty much liquefies on the inside and fluids just leak out, and it causes shock, seizures, and or organ failure. Hemorrhaging is thought to be due to a malfunction of the blood clotting system in which infected macrophages will trigger blood clotting in a local area, and this depletes the body of the serum clotting proteins needed, and so the rest of the body then cannot clot and is then susceptible to hemorrhages. This does occur, Ebola, primarily in Africa. Although, like I mentioned, there was an outbreak in Germany of Marburg virus. There has also been an Ebola Reston outbreak in Reston, Virginia, in the U.S. This did not happen in any people, but it happened in monkeys in a research facility, and it is the basis of the book Hot Zone. So transmission of this requires body contact. It's transmitted from person to person by contact with bodily fluids of the infected individual. Here is an image of the Ebola virus. They are filamentous. And so what that means is they look like a filament or like a long strand, linear in structure. What's cool about them, or kind of cute about them, is that many of them will have like one end kind of wraps around and it looks sort of like a curlicue or a little comma. They don't all have that clearly, but a lot of them do. You'll see that in many cases. All right, so here is sort of a map showing you places where Ebola and Marburg outbreaks have occurred in Africa, and here are some places where Ebola and Marburg has occurred in Europe. I don't show an image of the U.S. with, you would have to have an Ebola Reston, little yellow triangle there, and Reston, Virginia, because it has happened. All right, diagnosis is going to be based on characteristic symptoms and presence of virus in the blood. It does occur primarily in Africa, and this is presumably where the natural host lives. We do think that it might be a bat. We think that hemorrhagic viruses probably initially infect humans by contact with the bat host, and then humans transmit the virus among themselves by contact with bodily fluid, especially blood. Airborne has been demonstrated in the laboratory, but such transmission has not been shown in natural settings, hospitals, or mortuaries. Ebola is fatal in up to 90% of the cases, so it really has a high mortality rate. Treatment, right now, there is no vaccine, which you're going to see. The video does talk a little bit about this, but treatment right now involves just basically like supportive treatment where they try to replace fluid and electrolytes. There have been, and this is kind of interesting because you might have heard them talking about this with the COVID-19 situation that we're currently under, dealing with now with this pandemic. They have been trying to treat some COVID-19 patients with antibodies from people that have recovered from COVID-19 or recovered from the coronavirus. And that's what they do in the video with this Ebola. The doctors there, they try a real experimental type treatment where they take, antibodies from someone that has survived Ebola and put it into specifically one of their nurses that is currently suffering from Ebola. As she was treating a patient, she got ill. And so they treated her with antibodies like this, and it helps her recover. So it's pretty cool. All right, so I'm not going to talk anymore about Ebola, but instead what I want you to do is go to Canvas for the Ebola video and question set. I want you to, like I said, watch that video for 414, and then answer the questions and turn them in onto Canvas. I will be available tomorrow on 4/7 and on 4/14 by Zoom if you want to click in and ask me some questions. Let me go to Canvas real quick and just sort of show you. Let's see, get out of assignments here. Let's go back to our home page. If you are on the home page and you go right down to videos and question sets, here's the Ebola one. You click on that, you're going to see the Ebola video and question set. All right, let's go back to this. Okay, let's look at a case study, because I just went through and talked to you about Ebola, which is an example of a cardiovascular infection that is not it doesn't fit the normal, case where I told you that somebody needs to be immunocompromised for this to happen, because I said that normally these types of infections don't happen. And then I showed you Ebola, which is totally against that, because someone does not have to be immunocompromised at all to get Ebola. You can be perfectly healthy. But this is a case study that goes back to the norm. All right, so it says a man in his mid-30s visits the physician complaining of shortness of breath, right? That was one of the signs of cardiovascular or systemic infection, and persistent cough for over 3 weeks. So it also sounds like he may have a lung infection. Upon examination, the doctor notes that the client has a history of asthma, could be the reason for his cough, and intravenous drug use. Remember, IV drug use weakens the immune system. Also puts the person at risk for contamination with the dirty needle. Believing him to have an upper respiratory disturbance, the physician orders a steroid to reduce inflammation. Steroids will lower the immune response and therefore reduce the inflammation and reduce symptoms and signs and symptoms. But could be bad, right? Because if you lower the immune system, it could allow the infection to get worse. All right, 2 weeks later, the man's signs and symptoms were worse. So that sounds like that's what happens. He begins to experience dizziness, extreme fatigue. He goes to the emergency room. When he arrives, his heart rate is accelerated and he is dehydrated. The ER staff administers IV fluids, takes blood for analysis, and x-rays his chest. The x-ray film shows an inflamed, abnormally enlarged heart and fluid throughout the lungs. His blood culture grows Streptococcus pneumoniae. How could the man have developed bacteremia? What factors in his medical treatment may have exacerbated the infection? And what factors in the man's history may have led to his infection? All right, so I normally do this sort of as a class activity, and I have people think about this in their groups, but I just want to kind of have you think about this on your own. Answer these questions if you want to, and then please zoom in on the 7th or on the 14th and let me know if you have questions about this, okay? This is a question for thought. All right, let's get by this, because these are the answers. All right, Bacterial, cardiovascular, and systemic diseases. So let's go back to some of these bacterial type diseases. I showed you an example of a viral disease with Ebola. What about an example of a bacterial systemic disease? We've talked about this already, bubonic plague. Remember, this is characterized by enlarged lymph nodes in the armpit or groin called buboes. It is caused by this gram-negative bacteria, this gram-negative rod, Yersinia pestis. And it can cause pneumonic plague when the bacteria spreads to the lungs. All right, now here's the bubo. Remember, this is transmitted by flea bite. All right, so what has to happen when you get bubonic plague if it's coming into your bloodstream by a flea bite? Or maybe you rub the feces. You know, you can't inhale the flea or rodent feces. You can't inhale the bacteria this way. But if you are bitten with the flea, that means that the bacteria is going right into your bloodstream. And that means that you have a systemic infection. So yeah, anytime you have an infection with one of these blood-sucking insects, it is immediately a systemic infection. All right? And so plague, yes, is a systemic infection. Okay. Wow. Just something to think about. Remember, here is sort of our transmission life cycle, right? You've got the natural sort of endemic infections in these rodents, okay? And if one of these fleas comes from these rodents, jumps to the human and bites, it's going to inject the bacteria into the bloodstream. It does also show direct contact. You could contact the rodent or its feces and inhale and end up with pneumonic plague, so that can happen, okay? And then once inside the body, if it spreads to the lungs, now the bacteria can then be spread from person to person by airborne or droplet transmission. All right, but the initial infection is, I shouldn't say the initial infection because it could be inhaled. But if it's coming by a flea bite, it's systemic. All right, what about Lyme disease? All right, we've already talked about Lyme disease. Remember we talked about the spirochete bacteria, Borrelia burgdorferi, way back when. Seems like it was a long time ago. About the same time we talked about the plague. But Lyme disease, because it is carried by the deer tick, and deer ticks are blood-sucking insects. This is also a systemic infection. It does have 3 stages. It starts out with that bullseye rash at the initial infection site, but then it ends up with neurological type symptoms and leads to severe arthritis in later stages. All right, let's look at these signs and symptoms. Sorry. All right, so the early localized stage 1, this is localized Lyme infection. This is going to be an expanding circular red rash. You will have flu-like symptoms, including lack of energy, headache and stiff neck, fever and chills, muscle and joint pain, swollen lymph nodes. Stage 2, this is when you have more of the neurological type symptoms. This is when they say it is early disseminated. So it is starting to leave this localized site, but it's not completely disseminated all the way throughout the entire body. It's early dissemination. This is when you're going to get more rashes. More rashes may appear on other parts of the body as the infection spreads. You'll get pain, weakness, or numbness in the arms or legs, not being able to use the muscles of the face, so you can get some facial paralysis. You can get headaches or fainting that starts or continues to happen. You can have poor memory and reduced ability to concentrate. You can end up with conjunctivitis, pink eye, or sometimes damage to deeper tissues in the eyes. Pain, redness, and swelling in many of the large joints, usually your knees, and then occasional rapid heartbeats, palpitations of the heart as it spreads to the heart. Stage 3, where I said you had the severe arthritis, that is the last stage of Lyme disease. It's usually arthritis of the knee, but you also can have numbness, if I can talk, gosh, and tingling in hands, feet, or back, not being able, continued paralysis of the face, feeling very tired, continued problems with memory, mood, or sleep, and sometimes trouble sleeping. And then, of course, heart problems such as pericarditis, as you end up with inflammation, or endocarditis as well, as inflammation or structure surrounding or inside the heart begins to be a problem. Here is an image of sort of a blood sample from someone that has Lyme's disease, and what you see is these are the red blood cells, and this is the Borrelia spirochete pathogen there. Here is the sort of transmission cycle. Remember, we've seen this before. What you're looking at to find the beginning is just find the numbers. You can have uninfected tick eggs hatch, and what happens is larvae come out. These are really, really tiny, okay? Larvae are basically the size of like a poppy seed. They say that the adults are the size of a sesame seed. These are like tiny little specks, okay? You can barely even see these. These are presumably uninfected because they've just hatched, okay? But these larvae must undergo metamorphosis. First, they have to become a nymph, and then the nymph have to become an adult, okay? So there's several stages here. The larvae must get a blood meal. Small mammals or birds usually is the victim here, and then after feeding, they're going to drop back off. And then they're going to undergo metamorphosis over summer and fall and winter to become the nymph. All right, they're a little bit larger. These nymphs, here's a picture of the nymph, just to give you an idea, and he's larger than this guy was. It's crazy. These guys, you can't even see their legs. It's ridiculous. Anyway, the nymphs then will feed again on animals or humans. They can be infected at this stage because they've already gotten a blood meal. These guys can be infected with Borrelia. And so when the larvae feed on these, they can pick up Borrelia and become an infected nymph. And then they can feed on humans or animals and pass the Borrelia to them in this stage. So they're going to feed again. And then after they feed as nymphs, they can then become adult ticks. And then adult ticks, again, will feed on deer or humans or whatever in order to lay their eggs. All right, so every stage kind of requires a blood meal. The larvae must feed to become the nymph must feed to become the adult, and the adults must feed to lay eggs. And anybody past, well, once these larvae feed and become nymphs, from the nymph and on, they're infectious, or they could be. All right. This is, of course, one of the most reported vector-borne diseases in the U.S., and it's on the rise. We see numbers going up and up and up. We have seen a recent dip, but we don't know if that's just, there's been dips along the way, so it could still be climbing. We think that this is the reasons that Lyme disease is going up and that there's an increase is, land development, just movement of human populations into woodland areas. There's protection of deer populations. So deer populations are booming. We also have loss of predator populations, so like wolves and coyotes and things, because as people move into the woodlands and we break up and colonize, clear land and forest land, those predators are just naturally declining. And so the deer, their populations are going up and up and up, and there's more and more humans coming into contact with them. So this is sort of showing you areas with the highest risk are areas where there's more people. It's pretty interesting. Or also lots of populations of deer. And here's a graph showing you cases of the thousands. Here's the recent dip that I'm referring to, but of course, like you see, there's dips going all along, and the trend is upward. All right, so treatment and prevention of this, the treatment and diagnosis anyway, is going to be based on signs and symptoms. Bacteria are rarely detected in the blood. It's mostly signs and symptoms, and they can look for antibodies to the bacteria. They're going to use antimicrobial drugs, especially effective in the early phases treatment of later phases is difficult, and people can end up with chronic Lyme. What you want to do to prevent this is prevent getting bitten by deer ticks. You need to wear repellent and protective clothing. All right, let's move on to another type of infection. Let's talk about infectious mononucleosis. This is not a bacteria like Lyme disease was, and instead this is a virus. Infectious mononucleosis is commonly known as kissing disease or mono, and it is a condition resulting from infected B cells. I'm going to show you that. The virus that causes this is Epstein-Barr virus. Epstein-Barr or EBV virus is also human herpes virus 4. So it is a herpes virus, and it does establish a latent infection in the host, meaning it is never cleared. Once you are infected with monovirus, the Epstein-Barr virus, you will have it for life, and it is implicated in a number of other diseases I'll talk to you about. Signs and symptoms of mono are going to be severe sore throat and fever that will occur initially. You're going to have extreme fatigue, swollen lymph nodes, appetite loss. Transmission of this, you'll also have headache and also inability to concentrate. It can last for months and months and months, okay? You can also have what's called recurrent mono, where it's sort of you have like bouts of these signs and symptoms, and then it kind of goes away. And then you get bouts of these again, and then it goes back away. And bouts again and goes back away. So it's kind of up and down, up and down. As far as how you get this, it is usually occurring by saliva. That's why they call it the kissing disease. And during sharing of drinking glasses or utensils. Okay. This virus will initially infect the cells that line the throat, the epithelial cells that line the throat, and the salivary glands. And then it will eventually enter the bloodstream and kill B cells, infect B cells, excuse me. And then what happens is, once it infects the B cells, you start getting T cells attacking and killing the infected B cells. So once the B cells get infected, it sort of elicits this war that starts between the B cells and T cells. And that the B cell and T cell battle is what tends to produce the signs and symptoms of mono. Okay. Something very, very interesting about this, it does depend on the immune status of the host. So I think this is really interesting. So it's really common in children. Children that get mono, because their immune system is kind of weak, it's not like it's completely lacking, so they're not considered immunocompetent or immunocompromised, excuse me. And they're not marked as having weak immune systems, but we know their immune systems aren't completely developed like as an adult, okay? So they won't have the full reaction, okay? This tends to, so if they have some reaction but not strong like an adult, it tends to result in like this truce. So they have truce between mono and the host, okay? So these guys are asymptomatic. However, as the immune system develops and you become an adult, adults will have what is with the normal immune systems, they would have a vigorous response, and they have the signs and symptoms of mono. They are the ones that get the B cells and T cell war happening that causes the terrible signs and symptoms. These guys have B cells that are infected, but the T cells just don't react that much, and so it's not really symptomatic, okay? If you are lower than like a child's immune system, though, if you end up in a situation where you are immunocompromised, okay, so this is the state of cellular immunity. If you have normal immune response, asymptomatic, vigorous immune response, symptomatic, and you have mono. If you have a poor or lacking immunity, you can end up, depending on the grade or the actual status of your immune system, you can end up with what's called Burkitt's lymphoma or chronic fatigue syndrome. There's also the risk of cancers. that are associated with Epstein-Barr virus. Okay, we don't have a direct link, but we know that Epstein-Barr virus is associated with these types of infections. So see, it says EEB implicated, not proven. Right? There's also this other situation called oral hairy leukoplakia. This is a darkening and cancerous changes of the tongue. So it is a type of nasopharyngeal cancer, and again, EBV is implicated, not proven. All right. Again, transmission occurs by saliva. And I should tell you that this oral hairy leukoplakia only occurs in people with a T cell deficiency, malnutrition, are very old, elderly, or AIDS patients. Also transplant recipients. Okay. Okay, so let's go back. I forgot to tell you that. As far as how many of us, it says the majority of adults have antibodies against EBV. So they say 90% of Americans over the age of 30 have antibodies to Epstein-Barr virus, most often acquired during the teenage years. So most of us have this. Yay! Treatment is going to focus on relieving symptoms. There really is no treatment. And prevention is difficult. You just don't want to share, don't kiss or share saliva with people that are infected. That's about what you can do there. All right. In addition to the bacteria and the viruses we have talked about, I want you to know that protozoa can also cause systemic type infections in humans. And so I want to mention toxoplasmosis and malaria. All right, malaria. Signs and symptoms. Remember, malaria had the 2 to 3 day cycle where it infected the red blood cells and caused them to lyse. And then they were released. And then they infected the red blood cells again, reproduced, caused them to lyse, and then they were released. And this happened on 2 to 3 day cycles. And they had these chills and fever and weakness and fatigue. And you can have all kinds of neurological symptoms as well. Remember, there was four species of Plasmodium that could cause malaria. Plasmodium malariae, Plasmodium vivax, and some others. And disease severity did depend on which one of those species were involved. Here was our life cycle. And again, remember, it was transmitted by this Anopheles, blood-sucking insect, right? The mosquito. And so, of course, when the mosquito bites, it's going to inject the parasites into the bloodstream, right? They go to the liver first and invade the liver cells and reproduce there and undergo, metamorphosis where they're released. And then they come out and then they start invading the blood cells, right? And they reproduce and undergo metamorphosis in the blood cells, right? So they're in the bloodstream. This is definitely systemic. We did talk about lots of virulence factors. We said that the reproductive cycle, with it being so complex, that was a virulence factor. We said that malaria had a secretome. Remember, there was like 300 to 400 proteins that were injected into the red blood cells that would cause the red blood cells to sort of remodel. Remember, it made the red blood cells like more suitable for the malaria parasite to grow and reproduce, cause the red blood cells to stop circulating and adhere to certain tissues, cause clots and things. Remember, we also talked about the fact that malaria infection caused a change in body chemistry such that it was attractive to other mosquito bites. Yeah, we talked about, I forgot to mention Plasmodium falciparum. That was one of the ones I didn't say just before. This was the most severe form of malaria. We did say that certain people could be resistant to malaria. Remember all of that. We've talked about malaria so many times I don't want to go back over this again. Prevention of malaria, again, there is no vaccine. We're going to try to control mosquitoes. Toxoplasmosis was another one. Remember, this was Toxoplasma gondii. This is also a protist. This one was, I guess the definitive factor here that helped me remind it anyway was that it came from cats. right? Most cats have toxoplasmosis, and so if you want to stay away from cat feces, and you also want to avoid digging in your garden. If you do, you want to, wash your hands, because there can be toxoplasmosis parasites from cat feces there. This one also was kind of notable to me because this one could cross the placenta. So if a pregnant person was infected with toxoplasmosis, it could cross the placenta over into the fetus and cause stillbirth, epilepsy, mental retardation of the fetus. So this is really important in pregnant women. Here was the life cycle of toxoplasma. Remember, it was sexual reproduction occurred in cats, in the cat's digestive system, and then these little cysts would be shed out with the feces. And then if someone accidentally ingests these cysts, they could then get infected with toxoplasmosis. It could be a human accidentally ingesting the cyst, because cysts are not only shed in feces, these cysts could be picked up by an herbivore, right? And then these cysts will embed in the muscles of the herbivore, right? And so if we ingest the herbivore, ingest those cysts, then we can get toxoplasmosis. Also, what was cool about this was infection with toxoplasmosis, we know, was we talked about the fact that it could change behavior of the infected host. Remember, it caused rats, for example, to be less fearful of cats, and they were actually attracted to the scent of cats, which helped the pathogen move up the food chain. They talked about changes in humans. They noted that it was able to change dopamine levels, for example, in the brain, and it talked about more risk-taking behavior in males, and then females being more loving and warm. So it definitely changes the behavior of the host, which is pretty cool. Treatment of this, treatment is going to be, they do have drugs, but it's typically only needed in AIDS patients or pregnant women or newborns, because it's self-limiting in most people. Most people would only maybe have mild flu-like symptoms, if anything. And so they wouldn't even notice that they're infected. All right, that is all I have as far as cardiovascular diseases. You might notice, I'm going to show you this because it's hidden so it wouldn't show in the, you might notice I've got some slides at the end on Chagas disease. This is pretty cool, but I didn't really want to cover it with you all. It's transmitted by a kissing bug, and it causes heart infections. It's really, really prevalent in tropical regions. So it's interesting. If you want to look at it, you can, but it won't be on the exam. All right. So please watch, as you're watching this video, as you watch it again, or as you go over this, make a list of your questions and then zoom in or email me and let me know what you need help with. All right. I'd love to help you. Okay.